but they weren't even the best interviewing candidate. We pick them up.
But there are advantages to that and disadvantages to that.
Because we would sit there and try to hire for skill all day and pass so many great candidates. They got to meet this criteria on the job description. It's unrealistic expectations, and that you can train anybody to do anything.
To perform the job effectively almost immediately, based on their personality, their traits, their values, their ethics, and their cultural fit.
Thank you. Thank you for inviting me to this, Dr. Pete. I'm excited to be here. I think you posed a very important question. How do you hire and what do you hire for?
Exactly. Many times, especially as hiring managers, we often trying to get the right person in, and we often hire for skill because we need them in. We don't want to have to train them, but there are advantages to that and disadvantages to that. You know what I'm saying? What are your thoughts on it?
It's interesting, right? Because we would sit there and try to hire for skill all day and pass so many great candidates because we're looking for that needle in the haystack. They got to meet this criteria on the job description. Must have a master's degree, 10 years of experience, then sold milk in Honduras. We have these unrealistic expectations. So you have to kind of walk a tightrope and hire for skill, but also hire for character. I'm a big fan that you can train anybody to do anything. Invest your time into them, you can train them to do it. Now, clearly it's things you can't. I can't train somebody to be a nurse if they're not a nurse. But for the most part, a lot of the skills we can train. I mean, you have your doctorate degree, you have multiple masters and everything else, but you get to that job, they still teach you to do it the way they want you to do it.
There are pros and cons to both styles of assessment in terms of hiring. When you're hiring for skill, that type of approach really is about, expertise in a particular field, and you're looking to hire a candidate who possesses the specific skill and knowledge to perform the job effectively almost immediately. But hiring for character, you're more focusing on the long term.
Yep.
You're focusing on evaluating the candidate based on their personality, their traits, their values, their ethics, and their cultural fit to the organization as a whole. So when you're looking at hiring for character, it's more of a long-term versus a short-term. Hiring for skill has more of a short-term goal. It's got a short-term perspective, in my opinion, because it really aims to fill an immediate need, a job opening with candidates who can hit the ground running. You know what I mean? And you see that a lot in nursing. But when you're hiring for character, it's based on a long-term commitment and investment, emphasizing the potential for the professional growth within the organization, and it aims to identify individuals that align with the company's core values.
No, I think you hit the nail on the head. What's interesting is when you're looking at hiring for skill, you're feeling a need right now. And to your point, when you're hiring for character, that's a long-term commitment. And oftentimes we make a hire based on the skill set, but they weren't even the best interviewing candidate. We pick them up because they checked these boxes, but they didn't answer the questions appropriately. They didn't show up to the interview appropriately. They references didn't check out. I can't tell you how many times I've seen somebody get hired because of who they know, or, well, this was the best person with the most qualified skill set. But once again, to your point, what about character? Because character is what we should be looking at, because we're bringing somebody into a milieu. How are they going to work in this milieu, into this environment? We're not only dealing with human lives, we're dealing with other relationships, whether it's professionally or personally. So how is this person going to come in and interact with our leadership team, with the residents or patients or members, whatever you call them? And then how are they going to interact with the families?
Right.
So there's a different level of style of interview that's required for healthcare positions, that I would say, especially like when you're interviewing for a DON, right? She may have all the skills, may be the best nurse, may be the best at nursing, but does she meet what you're trying to achieve and the culture you're trying to maintain within your organization? And that falls back to character.
But the other thing that falls back to character is the ability to adapt, the adaptability and the development of the individual. Sometimes, when you're looking for skill-based hires, when you're hiring people for skill, they may be good, but they might struggle to adapt, to new challenges or new roles required for different, roles they have in the organization. Well, as opposed to hiring for character, you get somebody who you hire for character, they often are adaptable and trainable because they possess qualities like a positive attitude, a willingness to learn, they're teachable, and the ability to collaborate effectively with others. So a lot of times that character allows them to move further than just the skill in terms of adaptability.
When you said that, what I thought of 2020. at the beginning, middle of COVID. All the people with skill and didn't have character, they just faded. I can't tell you how many resignations I took at the beginning of COVID because they had the skill set but they didn't have the character. They weren't there. Oh, I remember somebody came in with a note. I won't say that person's name. They came in with a doctor's note from a pediatrician. I said, "You're a grown man. It's no way no pediatrician told you this. Like, what are you talking about?" Now, we know as nurses, as healthcare providers, you can potentially get a doctor. You know, we all have doctor friends and colleagues, and they will give you a note for whatever, you know. It's just how the game goes. So when he walked into my office, had the best skill in the world, but poor character, he said, I have to quit because I can't work with COVID patients. And I said, okay, give me your proof. And it's from his child pediatrician. And we both laughed, and he resigned. But it was the character piece, right? So when I was searching for people in the height of COVID, I was looking for character. It wasn't necessarily skill. It was her character, people who I believe was there for the right reasons, you know. And it was interesting during COVID, we had to do a lot of hiring really fast because I remember like having COVID units, having dedicated housekeepers to the COVID unit. Like we had to hire very quickly, but it wasn't just skill. It was for people who was going to, like I say, gel in that milieu and really just bring something to the team versus I'm great at starting the IV. I'm great at mopping the floor, right? How are you going to interact with these patients? How are you going to interact with these staffs during the height of COVID?
Right. And, you know, there's another aspect that, you know, you can think about when you're talking about hiring for skill versus character. And that is mitigating risk and mistakes. When you got people with the skill, they may have the expertise, you know, to handle the things, but do they have the expertise in terms of ethical dilemmas and behavioral mistakes, you know, and so when you're hiring for character, the folks that you hire for character are less likely to exhibit like problematic behaviors or ethical lapses.
Yeah.
They might require some training for some specific technical skill, but for the most part, you know, they can handle the ethical dilemmas, and they will come up in the nursing home or in the healthcare industry. You know, as you know for yourself, both in the acute setting and the long-term environment, there are many ethical dilemmas that require somebody with good character to make moral sound decisions. You know,
you talk about ethical and making moral sound decisions. You know, that's how I judge you in the way that you make decisions when no one's looking. You know, not what you do in front of people, right? Because everybody always has their best behavior on. I'm looking for how you make decisions when nobody's looking. What are your choices when nobody's looking? Because that's somebody I can trust on the team. You know, as a nursing home administrator, you oversee an organization. You are a CEO. You know, whether people know it or not, you are a CEO of an organization. You can have anywhere between 50 to 200 people reporting to you, directly reporting, you know, to you as the administrator, and then also have anywhere. I've dealt with some nursing homes that have 300-400 people in a nursing home, right? Multi-facility, multi-floor nursing homes, down to the 20-30 bed nursing home. So I think that when we talk about character and skill, it's, to me, you just, as an administrator, you have to blend the lines, and you have to make sure you're getting somebody that has the right combination of skill, but also the right combination of character. And given the opportunity to choose between both, I'm going to choose character because I can always teach you the skill. But if you have a skill,
I'm glad you mentioned that, because this conversation is not about saying that there's no room for skill. You know, I'm not saying don't hire for skill. I'm simply saying there should be a balance. You know what I mean? There should be a balance between skill and character. I think skill is needed. We don't need anybody working for us that has no technical skill, but I need them with that to be teachable.
Yes.
And have that character where they can learn and not be so, oh, I've been doing this 30 years and I'm not, you know, that whole old saying, you can't teach a dog new tricks. You know what I mean? So are they adaptable? Are they flexible? What are their values? What are their core values? Do they align with the organization? It's great to have the skill. We do need people that are skilled in what they do. Please don't get me wrong. But I need that character. I need that person to have good character. What happens when the customer's not satisfied? What does service recovery look like for that individual? Other than being a nurse, a respiratory therapist, a physical therapist, occupational therapist, a dietitian, what does that service recovery look like? Other being a CNA, what does that service recovery look like? How is your character going to lead you to help serve a person that may not have had a good experience? And that's where your character comes in.
You mentioned something key. You talk about service recovery. I'm going to deviate a little bit, but we don't talk enough about service recovery, customer service. Healthcare is a customer service business. And I think that in my career, I can't tell you the amount of times I've done service recovery, and I've done it because it's gotten up to me as an administrator when it should have never passed me. It never got to me. I don't understand how it got past a manager, then a director, then me. So as an administrator, it's my job to educate people on service recovery. And like you said, you have to start with the character. I'm not one to say the customer's always right, but in the essence of a person is sick and ill, I feel like we have to be mindful that this person may lash out. They may say things, they may do things. That's not the typical mode for them, especially in a nursing home setting, right? We take people in a nursing home setting who were independent yesterday. They were walking yesterday. They were able to do whatever they want. And then they slip and fail. They land in a nursing home, and we, have a new set of rules and regulations for them. And we act surprised when people kind of lash out or they don't conform to the norms, and we give them labels such as complicated, impulsive. When we talk about customer service, we have to learn how to deal with all types of residents, and avoid labels. And to me, it goes back to character, right? Is that person going to work with that individual, or are they just going to say, this is cut and dry. You need to do this because I'm here to do this, right? And it goes back to character. And I think that you hit the nail on the head, right? Hire for some level of character, because you want somebody who can also do service recovery, because service recovery helps keep your name in the community good. It keeps people wanting to come to your organization.
Right. This whole time we were talking, I've been looking at my other screen. I didn't realize I was looking at my second screen. And probably everybody was looking at my other side and didn't see my.
It's still your good side.
But it's a pleasure. It was a pleasure talking to you today. And just kind of having this open conversation. I don't know. I just kind of thought about it the other day. Having to hire people. And we all work as hiring managers at time, and we do interviews on potential candidates. It's just an interesting conversation to have. What do you do? For those of you that are out there, put your comments below. Do you hire for character, or do you hire for skill, or is there a balance in between the two? I personally have a balance between the two. And listen here, this is my man right here, DJ Demetrius here, and he is the owner operator of SMK Medical. And if you're looking for somebody to help you with your plan of correction, to help you with your MDS and stuff like that, he is your man.
Hey, I appreciate it.
He can help you. So give him a shout out, SMK Medical LLC at gmail.com, and he'll be happy to help you. Listen here, DJ, it was a pleasure talking to you today. As always, I'm always on your platform. I'm glad you stopped by to hang out with me for a little bit. This was
how can people reach
impromptu? We didn't even plan this. We just kind of, hey, let's get online.
But listen, how can people reach you? I know you plugged SMK, and that's not even. I came here to support you. How can people reach you, Dr. P, if they need guidance, if they need coaching, if they need to set professional or personal goals? Talk to us about Dr. P and your platform that you have, right? Because you invited me here. This ain't about SMK. It's about you. Tell Tell us about you.
I'm always willing to serve, sir. Well, my website is imdrpet.com, pete.com. I'm drpete.com, and I specialize in helping people get clarity and set their goals and their plan. I'm the one to help you from inception and bridging that road to the goal. So you have a goal, you have a desire. I'm gonna help you get clarity and help you get on that road to success. Help you develop some strategies to get to where you need to get. And if you need help in terms of leadership coaching, I'm your man. I'm not. I didn't say I was perfect. This is all a learning game. But I've been doing this a good 30 years. I've amassed a lot of experience in how to build teams and how to help people grow. So I'm willing to help others grow themselves. I believe that everyone has a destiny, and it's time for you to realize your destiny and work. I wouldn't work someplace I'm unhappy.
Ooh.
Yeah, I would want to be in purpose. Opportunities sometimes don't present themselves with an open door. Sometimes you got to push the door open. Sometimes people wait to unlock their potential. They waiting for something to come by. No, sometimes you got to push that door open. Okay,
man. So yeah. I see you have speaking engagements on here. Talk to us about that. What does that look like for you? For somebody to get you to come out and inspire their nursing home, their facility, their university. What does that look like?
It could be team building exercises. It could be me coming over there and working with your team and getting them to be on one accord, getting them to work together on one accord. Part of my when I look at team dynamics, I love the book from Patrick Lencioni, who talks about the 5 dysfunctions of a team. And I really like to talk about that because it really hones in on what the dynamics that are needed for team growth and for productivity within a team. So my engagements stem from teaching, talking to teams. I've done some consulting where we've done some assessments and determine where the problem in the organization is and help them and give them a strategy on how to fix it. Actually, that's how I even got my doctorate. It was a business consulting program where I had to consult an organization using the Malcolm Baldrige performance criteria. And based on that, I found the problem they were having, and then I helped them solve it. So yeah. So that's pretty much the gamut of it. But let me tell you, I'm a firm believer that you can do it. Having been in the military, and it took me some time to even get my bachelor's. It took me some time to get my mind straight. And after I got my bachelor's, there was no stopping. I kept going until I got my doctorate, but it took me 23 years to get my bachelor's. And that was some perseverance. It was stop, start, yeah. Raising children, going to war, coming back, going to deployments, coming back, relocating, finding a new college, So all that happened after 23 years. I got that bachelor degree, then there was no stopping after that. So, and that's why my book is coming out soon, The Power of Movement, Purposeful Strategies to Achieve Your Destiny. What does that look like?
Yes. Hey, man, I look forward to reading it. And I know you're going to come back here and share this information with us. I just appreciate you for inviting me on your platform. I think that you got a lot to say, and I'm just honored to be here. And thank you for the support. You supported me over the time we've known each other, right? Which is coming up on a year, really. That
I know, right? It's been that long.
But it's what, when two creatives get together, there's nothing that we can't do. You supported me at the start of Sound Leadership with DJ. Now we're approaching recording 50 episodes. Remember we did my 10th? We did my 10th.
Wow, you've been busy. That's good. That's good.
So I'm gonna have you come back and do the 50th episode again. You're gonna have to.
Pleasure. It'd be my pleasure to serve. Listen, it really irks me that sometimes you find people, they're like crabs in a barrel. They feel like, they don't want to help you get to where they are. I have no problems with that. What's for you, it is for you. No one can take it. And there's this saying that we used to say in church, what God has for me, it is for me. So you can do what you want to do. You do you, I'm going to do me. But at the end of the day, what God has for you, it is for you. I can't take it away. So there's room for everyone. For every McDonald's, there's a Burger King. For every Popeyes, there's a KFC. Chipotle, there's a Moe's. Subway, there's a Blimpies. They're all making money. They all have their little niche. There's room for everybody. There's no need to hinder or keep anybody down. So it's been a pleasure. Any way I can support you, I'm happy to do so. But thank you for joining. I'm jumping on this impromptu and talking about character versus skill. It was amazing. I hope this was beneficial to you all online. And if you have any comments, please drop them down below. I'd love to hear them. I'm always willing to learn too. So we look forward to seeing y'all soon.